Hello, my name is Andrew Collins, and I'm a medical student at the University of Central Florida College of Medicine. Today we're thrilled to present our research titled N95 Respirator and Surgical Mask Efficacy Against Respiratory Viral Illnesses in the Healthcare Setting, a systematic review and meta-analysis. We sought to answer if N95 respirators provide reduced infection from viral respiratory illness for healthcare workers in the hospital setting. Our data sources included PubMed, Medline, and the Cochrane Library databases from inception until September 2020. Of these studies, reference lists were also included and scanned. Study selection included randomized controlled trials, case control studies, and cohort studies examining face mask efficacy in reducing healthcare worker viral respiratory illness in a hospital setting. Figure 1 details our study selection method. The main outcomes we analyzed were the incidence of respiratory viral infection, influenza, and SARS-CoV virus in healthcare workers using N95 respirators and surgical masks. Studies that presented comparable data with similar interventions and outcome results were pooled together for joint analysis. The effect of these studies was assessed using risk ratios with 95% confidence intervals for the dichotomous data. One factor at a time sensitivity analysis revealed that results were unchanged even when excluding individual studies from each pooled analysis. Overall, results were pooled by grouped infection type, including influenza, non-influenza, and SARS-CoV viruses. Table 1 lists the included studies, which consists of 4 randomized controlled trials, 3 case control studies, and 1 retrospective cohort study. The included studies were published between 2003 and 2020 and involved a total of 9,164 participants. All included studies took place in a hospital setting and examined an adult study population of healthcare workers to assess mask-type PPE effectiveness against respiratory viral infection. Of the randomized controlled trials, all were level 1 evidence, while the case control studies and retrospective cohort study were level 3 evidence. The results of the Cochrane risk of bias tool can be seen in Table 2. None of the studies reported an assessment of compliance with the protocol regarding surgical mask or respirator use. Overall, 1 of the included randomized controlled trials was deemed high risk of bias, 1 had some risk, and 2 had low risk. Figures 2 through 7 depict the effectiveness of masking practices. In Figure 2, we assessed N95 respirator effectiveness versus surgical mask against influenza-like illness, which included both laboratory-confirmed and clinical diagnoses of influenza. This analysis included 4 randomized controlled trials and 1 case control study involving a total of 8,911 participants and demonstrated a statistically significant result favoring N95 respirator use over surgical masks. Figure 3 assessed non-influenza respiratory viral infection and included 3 randomized controlled trials, 2 case control studies, and 1 retrospective cohort study involving 8,543 participants. These findings once again were statistically significant favoring N95 respirators. Figure 4 assessed all respiratory viral infection, which included both influenza and non-influenza viruses. In total, all of the included studies were assessed in this measure, which involved 9,164 participants. The results once again were statistically significant, favoring N95 respirator use over surgical masks. It is important to note that the viral profile analysis was not uniform in these analyses. Some studies tested for up to 8 viruses, while others only tested for 1. Figure 5 analyzed SARS-CoV-1 and SARS-CoV-2 viruses and was measured by 2 case-controlled studies involving 215 participants. Once again, this result was statistically significant, favoring N95 respirator use over surgical masks to prevent COVID-19 and other SARS-CoV viruses. Studies analyzing specifically laboratory-confirmed respiratory viral infection were assessed by 4 randomized controlled trials and 1 case control study involving 8,911 participants seen in Figure 6. Once again, this result was statistically significant, reporting a decreased risk amongst N95 respirator users over surgical masks. Lastly, Figure 7 reported results of N95 respirator effectiveness versus surgical masks against laboratory-confirmed influenza, which was addressed by 4 randomized controlled trials involving 8,712 participants. Overall, the pooled result was actually not statistically significant, reporting no significant difference in the laboratory-confirmed influenza with N95 respirator use versus surgical masks. Results comparing N95 respirators and surgical masks for influenza-like illness, seen in Figure 2, which ended up including clinical diagnoses, and laboratory-confirmed influenza infection, seen in Figure 7, showed statistically significant and insignificant results respectively. This dichotomy highlights the importance of study design in these trials, as the clinical influenza diagnoses may have included other viral or bacterial pathogens presenting as influenza. In these trials, it's important to note that healthcare professionals have stated discomfort, most often being headaches, associated with N95 respirator use. Since providers are often required to wear these respirators for prolonged periods to protect against infection, side effects of use may become a detriment to compliance. In all studies comparing the effects of N95 respirators, it's difficult to ensure participant compliance throughout the study, which may lead to respirator manipulation and adjustment as well as frequent removal and reapplication, ultimately impacting the study outcomes comparing the respirators versus surgical masks. Additionally, included studies did not specify the type of surgical mask used and whether the mask type was consistent throughout the trial, posing a limitation for each of these studies. The nature of this meta-analysis is limited by the size and nature of the included studies. Many of the studies analyzed a heterogeneous group of viral illnesses that spread, reproduce, and potentially mutate in vastly different ways. This greatly limits the specificity of their results when attempting to compare the results to a pandemic such as with COVID-19. So in future studies, the authors recommend that further randomized controlled trials that compare surgical masks to N95 respirators assess compliance with surgical mask and respirator use, as well as analyze viral illness in each group with PCR and antibody testing-based assays before, during, and after the study period for all participants, while also studying a single viral pathogen and focusing the study location in a single treatment setting, for example, inpatient or outpatient specifically. In conclusion, this meta-analysis demonstrated a protective effect with the use of N95 respirators compared to surgical masks when assessing influenza, non-influenza respiratory viral infection, general respiratory viral infection, SARS-CoV viruses, and laboratory-confirmed respiratory viral infection. This suggests that N95 respirator use is protective for medical professionals and all healthcare workers who come into contact with certain viral respiratory diseases. Pooled analysis of recent evidence published during the COVID-19 pandemic showed a statistically significant protective effect of N95 respirators for the SARS-CoV-2 virus. This data supports the use of N95 respirators for all healthcare workers in the hospital setting when treating COVID-19 positive patients with active disease. Overall, the level of evidence analysis of N95 respirators and surgical mask effectiveness in healthcare setting consists of many high-level evidence randomized controlled trials and some low-level evidence case control and retrospective cohort studies. Significant heterogeneity existed with regards to assessment of viral transmission and the types of viral illnesses studied. This meta-analysis highlights the necessity for more robust research to help guide institutional and national policies regarding PPE use during the COVID-19 pandemic and with other viral disease outbreaks in the future.